Yeah, AI is really a very broad and deep term. Its first use cases are around knowledge aggregation and automation, and that means we can make the overall system more efficient.
Björn von Siemens is the co-founder of Caresyntax, a company revolutionizing surgical care with the use of AI, data analytics, and automation to make surgeries safer and more efficient.
The patients are using ChatGPT and other tools to educate themselves. That is really at the core of what we believe the future healthcare systems should look like.
Today, Caresyntax's platform is used in over 3,000 operating rooms around the world, supporting more than 32,000 surgical teams and optimizing millions of procedures each year.
If you have an image from a CT, MRT, so let's say a scan, and a doctor looks for an anomaly, they may or may not see all the anomalies. And the AI can make sure that everything in this picture is looked at.
Björn is dedicated to helping other healthcare innovators succeed. He invests in and mentors entrepreneurs who are working to improve healthcare systems around the world. Thank you for joining us, Björn.
Thank you, Caroline. It's nice to be here.
You know, AI is used in so many different capacities here, and people have such a varying degree of AI. You kind of have, you have the ChatGPT, and then you have, the Terminator. So I'd like you to talk in simplistic terms about what AI means for healthcare, how it helps, what it does, and how it's changing healthcare.
In healthcare, what we see in terms of applications, its first use cases are around knowledge aggregation and automation of, let's say, simpler administrative and simpler clinical tasks. And that means we can make the overall system more efficient. And that's in the first moment a very positive momentum that is continuing through different subsectors of healthcare. The other use case that I see as a very interesting one is that the patients are using, you mentioned ChatGPT and other tools to educate themselves. And that is really at the core of what we believe the future healthcare systems should look like. Educated patients that can take responsibility for their own health and healthcare, and where really the healthcare infrastructure and the system around is there to obviously support and be there when needed. But in many cases, the patients actually know with a little bit of information what's best for themselves.
Can you kind of give us an overview in terms of, ranging from diagnostic to actually surgery, how AI is coming into play, like real concrete examples of what it's doing?
In diagnostics, it's being used in, for example, radiology, or in maybe, let's say, more complex DNA or even blood sampling testing. And a great example in diagnostics is a second opinion. If you have an image from a CT, MRT, so let's say a scan, and a doctor looks for an anomaly, they may or may not see all the anomalies, and they may be focused on actually a different disease or a different specialty. And the AI can make sure that everything in this picture is looked at. And so, the small cyst or the small tumor that maybe hasn't been spotted while doing a X-ray for a fracture is now being spotted because the orthopedic surgeon or the doctor or the nurse that was looking at the radio or X-ray scan beforehand just wasn't trained and wasn't used to looking for it. So I think the second opinion is a very good example of AI being very useful at scale and very cheap to deploy. The therapeutic examples are, if you're looking into our core area, which is surgery, a bit more complex. And we see the first use cases really being in the before the surgical therapy really starts, educating the patient, understanding the patient needs, asking questions, and really preparing the patient optimally for the surgery, but also giving the opportunity for the care team, the surgeon, to engage and understand, what type of patient are we dealing with? Is it a high-risk patient? Is it a low-risk patient? To make choices for, urgency of case, site of care, choice of device. And that means we're entering really for the first time in surgery the area of precision medicine, so really personalized medicine. And that is, very, very useful because it will enable us to get to dramatically better outcomes with hopefully lower costs. So we're not talking about fully automated robotic care in either space, but we're really talking about enabling the care team, let's say the physician, the doctor, the nurses, to spend more time on the patient and less time with understanding the environment and the administrative, let's say, and regulatory compliance.
It made me think that it kind of offers a more comprehensive view. Would you put it in that? Because they look at the whole body and they spot things that a doctor might not necessarily see. You go to a cardiologist, are looking at your heart. You go to an oncologist, they're looking for cancer. But if you have this AI, from what you're telling me, it kind of seems like it can give you more of a whole body approach. Would you say that that's accurate?
Yeah, and I think that's what I mean when I think the responsibility shifts, or not the responsibility, but the ownership in a way shifts from the, let's say, amorphous, anonymous healthcare system, which is different from country to country and really depends. In many countries, there's not even a centralized patient record to the patient. And it's, I think, the first year where on average, the patient have more data, more health data about themselves than the system has. Let's say the compute power, the models that we have to understand and simulate and create a digital twin are powerful enough to enable a more holistic view. And that, of course, is very helpful because oftentimes the siloed approach, as you rightly said, looking at the cardiologist looks at the heart, the ophthalmologist at the eye, and then you have a connection obviously in between somehow. Maybe in this case it's a far-fetched one, but in many cases there is one. And so generating that image from a data perspective and clinical medicine perspective has been very, very difficult because you need so much knowledge and so much understanding, and having that in one place is something that machines can definitely do.
Do you think this kind of shift is something that's very necessary now? Do you think it's something that is more important now than it would have been 20 years ago because of a shift in healthcare trends or a shift in health in people? Or do you think it's something that, we could have saved a lot of lives if we'd used it, 50 years ago, if we had the technology?
Any of these tech use cases, if used in the right way, I think can definitely improve healthcare and improve diagnostics and move us more to a proactive healthcare system. And I think that we are in many markets and in many countries at a place where without those tools, we won't be able to provide the level of care that we are used to or that we have access to. And that means that because of lack of budget expansion and growth, we need to become much more efficient. And that's really what I think the first use cases at scale will be: much more efficient access to information and care around basic needs, and enabling the specialties really to focus on the cases that need the doctor, the surgeon, the specialist, the therapist. If we want to get to a level of care that is similar to what we have in the Western world globally, then we need different tools and different approaches. And that's something that we hope that with some of the tools that we are building or are affiliated in building can support.
I'd like to talk about your start into Caresyntax. Why did you decide to jump into the healthcare technology space to co-found Caresyntax, and was there a specific moment or experience that really led you in this direction?
There were multiple experiences that led me into this direction. I would say one is I wanted to be a surgeon or intensive care physician originally. It was my plan in my high school years, let's say, and then until early university days when, for different reasons, I decided to go into a different path. I had that as a firm kind of role model in mind, which is also part of my family, a large part of my family on my mother's side as doctors, physicians. And then I also had this opportunity, I would say, to learn more about business and entrepreneurship. And so for the first 10 years, I would say I gained experience and I gathered information around what it is I really like to do. And what I really find fascinating is technology entrepreneurship overall, let's say as a thematic force of change in the world. And I think that deploying this in healthcare is very challenging, but also potentially very rewarding, both emotionally and let's say, financially and from a perspective of intrinsic motivation. And so those factors combined then gave me the opportunity to search. And I had a few first in the late 2000s attempts to do something entrepreneurially, which weren't super successful. And through those, I met a lot of interesting people, and with some of them, I then co-founded Caresyntax, and that's been a great journey. Not an easy one, but certainly very interesting one and rewarding one from a perspective of impact and scaling. And now we're in a position where we can really help support and shape this sector or the subsector, which is a very significant one in healthcare, and hopefully inspire others to do the same.
Did you ever see a particular gap that needed filling in surgery specifically, like a problem that AI could help you solve?
Yes, for sure. It was a shocking, let's say, discovery when we went into operating rooms 10, 15 years ago to see that all these very, very sophisticated tools and people and materials and this very expensive space are not at all digitalized and connected. So in surgery, which is one of the major success stories of modern day medicine, every year 500 million surgeries or 500 million surgeries every day, thousands of lives are saved or changed to the better. But the tools that are around are still physical, and they're made by companies and organizations that are focused around medical devices that are, basically of physical nature. And so what we see and what we saw as a gap is really the digital side and the digital platform. And that is something we've seen emerge in a lot of other sectors and industries very successfully, companies that have transformed industries and made them much more efficient and much more scalable around the world. And in the operating room, there is a particularly, I would say, large gap in terms of variance of outcomes in between different surgical teams and different surgical setups and different hospitals in terms of variance of outcomes, of complications, of costs. And that is not a function of, I would say, unqualified or unmotivated people that work in surgery. Surgeons and surgical teams are some of the hardest working people I know. They get up in the morning at 5:30 and go into clinic and see the patients, and then they operate and then they take care. So many have 12, 16-hour days, but they don't have the digital tools. And that's really where I think we can support, and we can bring in not a solution for everyone and everything, but we can bring in a fundamental change of how the surgeon and the surgical team is supported, and that is with a more holistic approach from before, during, and after the surgery on the one hand, and with an open platform so that the data is exchangeable and the applications are chosen by the surgeon and by the patient, very much alike. We're choosing our own ecosystem of applications around us to support us during our work life and our day-to-day life. And so that will happen in surgery and that will happen in other areas. And we're part of that as an enabler and platform. And some applications we are developing ourselves, but many of the tens of thousands that are needed will be developed by others. And we're simply a data supplier and a provider of, let's say, the interface to the surgeon and the care team.
Do you have a specific goal in mind? And did you have like a specific goal when you started the company? What was your like mission statement, sort of? Like, what was there a single word that kind of drove the company's goals and attitudes?
I would say quality of care is very important. I would also say just overall safety. So we're talking about safer, smarter surgery. And I think that is what we really stand for. So making the environment that has a lot of uncertainties, a lot of risks, and patients that are fearful at the moment to go into the operating room and go into surgery, creating a sense of control and understanding and predictability. That is what we strive for. And there are many reasons for that. I think one is it's more motivating to see people joining us that have had experiences themselves or in their family, like myself as well, where surgeries or interventions have gone wrong, and potentially those could have been those errors or those just misallocations of certain devices could have been changed if there were better data points available. And so I think it's this kind of, I'd say, a virtuous cycle of really supporting the surgeon and the patient to be better prepared and understand what they're getting into and what to expect as well.
You're very brave to go into an industry where that's so heavily regulated. What has it been like to go through this kind of experience?
We started this about 12, 14 years ago. And I would say 7, 8 years ago, I think was when it changed from being predominantly negative to more and more positive, just also because of more and more people using the solution, and the gratification you get from users and from seeing the impact is so high that it makes it worthwhile. But for a significant period of time, it's a very tough journey. And speaking to other healthcare entrepreneurs and people around us in our ecosystem and our cohort, let's say, of digital health entrepreneurs or AI entrepreneurs in healthcare, there's many who've been around for 10, 15 years, and there's no one who would sit here and say this was a very easy ride. It takes a lot of time, it takes a lot of effort, and you have to kind of be okay with that, I guess, as an entrepreneur and as an individual. And then when you make your peace with it and you don't expect it to be quicker, then it actually becomes, as I said, very rewarding. And the people around are also in it for the right reasons, mostly because of this time element.
Right. They probably wouldn't be getting into it for a quick, buck, knowing how long it takes and how much work it actually takes.
Exactly. It's if you want to make money quickly, you don't get into that type of environment. And in healthcare, there are very few areas where you can make money quickly, and they would be mostly on the financial, maybe investment side. But even there, it's very difficult. And I would say it's always a long-term engagement. And that's how the entire space is built.
I want to talk about if you have any specific examples of how AI has really helped surgeons make better decisions during surgeries. if you have any stories of how the use of AI led to a better outcome.
So there's so many examples, and in the 3 million surgeries we support per year, there are obviously a lot of smaller and larger examples, but I like the one example which shows how everyone that is in this kind of surgical pathway wins from using more digital tools. And that is when we analyze a specific clinical pathway, let's say a hernia repair surgery or a knee replacement surgery. And in this case, we really take the patient factor analysis very seriously. So we collect a lot of data about the patient, the environment, the history, and then we can, before the patient even meets the surgeon and the surgical team, already predict certain outcome risks, but also certain, let's say, matchmaking of devices to the patients. And that really gives the surgeon and the care team the optimal opportunity to prepare for the surgery. In this case, the statistics are just amazing because you can see how, on the one hand, the risk of a complication goes down to, let's say, from 10% plus to sub 1% for
Oh,
the patient
wow.
or something going wrong. Yeah, it's really the variance is extremely high.
Yeah.
The ability to manage more patients in with the same care team goes up. So you have 8-10% more, let's say, throughput. Because of the complication rates going down, the profitability for the hospital also goes up. So hospitals
Sure.
by now, if they have a complication, they are covering the loss. So it's their penalties. And it's very hard sometimes to understand which patient, which device is needed for which patient maybe needs extra care because they live alone or they had a precondition that was not really easily to spot. And so we can help the providers and the surgeons spot those. And then obviously the patient understanding before and after the expectations of what will happen and what can the result be is also very important because a lot of it is about expectation management and psychologically being ready for this is going to be difficult, or maybe I'm expecting too much, or maybe I'm also too afraid because it's going to be quicker than I thought. And then the medical device companies and insurance companies can also improve their profit margins because they can adapt their solutions to the specific patient need. And for a medical device company, that may be the case of improving their device or matching their device to a specific population of patients that is really fitting for this type of a device. And for the insurer, of course, they don't have to cover the after effect of something going wrong, and they have the ability to match make. So really, in this situation, through data, everybody, and through AI, everybody kind of wins.
Yeah, I was thinking that. Everyone's a winner.
Yeah, and that sounds wonderful. And then you always ask, okay, why is not everybody using it? And there's other reasons for that, which are, yeah, as you mentioned earlier, there's regulatory hurdles, but there's also financing, which is, it's not cheap to implement just the digital infrastructure. So
Yeah.
connecting all these data points, you need a high powered computer in the operating room, which oftentimes just does not exist.
Right.
And the connectivity does not exist. So putting the infrastructure in place is an investment that needs to be made, and it is being made, and the systems are adapting to it. But it takes time, and then also the users need to be trained, and the algorithms need to be trained. So I think you can see in specific use cases that are large enough in terms of numbers of thousands of patients or millions of patients, you can see the real value of it. But it will take many, many years to be implemented at scale.
I was going to ask about patients. Like, what's their perspective on when you tell them, we're going to use a little bit of AI to explore what's going on with you, or we're going to bring it into the operating room. What kind of reception do you get from patients? And have you had any situations where they're surprised, or you're surprised by their reactions because they're either so positive or so negative?
Patients have mostly reacted very positively to this. And we've seen it already, I would say 10, 12 years ago. We started, as part of our solution, we are recording the entire surgery, or we're making at least an optional potential to record everything. And that means as a patient, you own that data, so you can ask for it. And so patients can, for the first time, basically say, I would like to have, a download link or USB stick or DVD or whatnot of the surgery, because many times you're under anesthesia and you're not experiencing it.
Oh my, I don't know if I'd want that.
Exactly. And I think you could, you can obviously have a redacted version, maybe, and it's usually also, of course, completely de-identified, right? At least in our hemispheres here in the EU and in many other places, patient and also provider identities are taken out. So you see
Sure.
what's going on, but you don't see the identity. It's kind of blurred. And
Yeah.
and that is an important element of this recording being done in a safe and compliant way. But it's interesting, and many patients are actually happy about it. And the very interesting part is the surgeons are very happy about it, because if you're unhappy about the outcome, sometimes the assumption is something went wrong.
Right,
And
right.
and then you have a discussion with the surgeon, and then if it's a qualitative discussion, it becomes very much a trust-based topic, and that is fine in some instances. But if you have the opportunity to go back and say, look, this was a very difficult case because of these anomalies, and we did this and this and that, and you can see how the process was followed and how much care was taken and how everybody was really doing their best, then as a patient, even though you're not maybe getting the result that you wanted, and obviously the surgeon and everybody else also wants the best possible result, but sometimes it's not possible, then everybody feels much better about it, and the litigation risk and all these other risk factors go down, and that's been quite interesting and helpful, because oftentimes the opposite is assumed. People just want to bury it and not know about it. But
Yeah.
it's such a decisive moment, and if you go into surgery, it's usually not voluntary, but really because something is seriously, needs to be taken care of, and otherwise, your life will not continue in the way that you would want it to. And so having a record of that and having an understanding of what happened in this critical moment when it really mattered is very valuable.
Can you differentiate the software AI as opposed to robotic AI in surgery? I think some people don't really understand software AI, including myself, fully. So if you could explain that and why it's been more impactful now.
Both software and hardware are interconnected and are needed. So, you cannot run any software without hardware. And so the physical embodiment of the AI output could be voice, it could be obviously also movement, it could be automated, let's say robotic arms or things like that. And that is at the moment in surgery still in its very infancy. So the robots that are used in the operating room are physical systems that are used by the surgeon to become, let's say, less dependent on the physical dexterity of the hands, and have a more sophisticated system that can, with less an invasion, millimeter invasive, get things done inside of the body of the patient. But the fully automated, let's say, robotic surgery that is connected to, let's say, a central compute power that guides the entire process from end to end and makes all the different movements happen does not exist, and in many instances will not exist for the next, let's say, years and decades to come. But if you compare it to a self-driving car, it's kind of not too dissimilar. So there's a lot of sensors. These are physical systems. They enable the AI models to learn and to see and to understand what's happening. And so let's say you have, cameras, you have radar, you have an understanding of the context, you have a prior experience, and all of that is part of the memory and of the, let's say, capabilities of the AI. And then you have real-time information coming in. So what is going on during the surgery, and can then be used by either the surgeon or the robotic system or the self-driving car to react, to stop, or to drive, and to turn, and to get to the place that the user wants it to go to. I think both is necessary, and if you look at how the Magnificent Seven or the large companies have evolved, that are the most valuable companies in the world, they have both. They have fantastic software, they have AI, they have fantastic hardware, because it's all about the user experience. And you
Right.
really want a system that is easy to use and intuitive and that supports you during the day-to-day. And those organizations and companies that develop the most user-centric and value additive, let's say, cyber physical systems, hardware, software combination, they will, in the end of the day, be the ones that are chosen by the surgeons, the patients, the caregivers. And that's what we're aiming to do and what others are aiming to do as well.
Looking back, can you think of a specific instance that was like truly rewarding? You wouldn't have had the same kind of positive outcome that you would have had without AI?
There are many instances, and an infection, something left in the body of the patient, preventing those things to happen, and doing that on a daily basis is not possible without AI, because humans make errors, and there's nothing wrong with that. It's human nature, and it's only with systems that support the humans and make sure that there's double, triple check, a second opinion, a third opinion, that we can reduce those errors to being marginal. Like in commercial airlines, right now, the risk of a crash is very, very, very low. And that's not because, let's say, fundamentally pilots are much, much better now than they used to be 50 or 100 years ago, but just the systems are much, much better.
Sure,
And
sure.
those are guided by the same, let's say, data analytics and AI principles that we can deploy in healthcare.
I'd like to talk a little bit about personalized medicine, which AI offers, and we talked a little bit about that before. How do real-time data analytics in the surgery help surgeons create more personalized care?
The best use case of AI, I think, is in the mid and long term is personalized care. And so in the future, what you would envision is if you have a condition, then we would create a virtual version of yourself, of Caroline, that is undergoing separate treatments, and then could simulate out years afterwards which one will enable you to recover best and live your fullest potential, and enjoy your life and your children and your grandchildren and so on, and or whatever your life goals may be. The idea is really to be able to predict the efficacy of outcomes in the short, mid, and long term, and do this with large amounts of data.
At what stage of the surgery would you say is personalized medicine most used? Before, during, after, or is it used throughout the whole process?
Or the AI tools are mostly used before, to understand which therapy might bring the best use case for the specific patient. And afterwards, in terms of understanding which patient needs more care in the prevention side, there are a lot of mostly, I would say, oncology related, so cancer related diagnostics that can be done on large populations for very cheap costs. And we can find out which are the risky patients. And then we technically should screen them, because one test is maybe $5 and one therapy is 70,000.
Right.
So finding those patients is also not so difficult, but then making sure that they get engaged and do the test. Even though it's a home-based test, some people need the extra call, some people maybe even need a visit, others will just comply by them getting an email and click through. So I would say these stratifying the patient and the engagement of the healthcare system with the patient is very important, because it really enables the system to become personal in how it engages with the patient, and then making sure that things are still followed through automatically or semi-automatically. And yeah, that is very scalable with technology, and that's not very scalable with humans, because with human it depends on us going to the doctor or us answering to a mail or something like this, and that can always be pushed aside or not happen. But if you have a system that is very persistent, then
sometimes people need that.
Sometimes people need that, and oftentimes it's in their best interest, and it's not.
Right. Oh, definitely.
About, yeah.
Yeah. How involved do you think surgeons need to be in interpreting these personalized results? Do you think that is still necessary or do you think that AI can kind of take the wheel?
I think that the surgeons and the doctor's job is really to interpret and translate, and the emotional care for the patient, and being there, and the patient feeling that they are understood, and that there's somebody that takes responsibility before, during, and after. That is very important, and that has statistically shown to be a very high contributor to positive outcomes. So it is part of the system and of humanizing the system that is absolutely necessary, and that part cannot be replaced. A lot of other systems around that can be, so that you really have a human experience when you go into the hospital, when you go into the operating room, when you go to the doctor. But all the rest, in terms of data transmission and preparation, analytics and understanding, is done by the machines. In certain areas, actually easier to talk to an AI than to a doctor.
Sure.
And so I think it's also about selecting those and saying, maybe I don't want to disclose this type of behavior or this type of condition to a human, but I feel totally okay if I know this is just a box. And
right. They won't judge me. The box won't judge me.
Exactly, the box won't judge me.
So you still see a place for surgeons in interpreting everything. How about in the actual surgery? Do you see a time when a surgeon will just kind of like be in control of kind of an autonomous AI system?
I think it's going to be similar to flying or to driving. And the surgeon will be involved in planning the surgery and basically diagnosing, preparing. And so the surgeon will always be needed, but let's say the task spectrum and the emphasis will shift from managing the direct intervention, physical, and 30-40% of time on administrative reporting, coding, reimbursement tasks. These things hopefully will start to dissipate and become more automated, so that we have more time with the patient before and after surgery, and then during the surgery really making sure that nothing goes wrong and being there in case systems are failing. So very similar to what you would have in an airplane.
Do you think this will change people's perspective of the surgical profession, or people who are considering entering the surgical profession?
Yes, I would say so. I think that we definitely need many more surgeons. So there's already today a huge gap between supply and demand. So surgeons are needed, and there's no system that can replace that. Not now, not in the future, because we need the human to human element in a lot of different ways, and we need people that understand medicine from end to end. But it will be more and more assisted by software and AI.
I'd like to ask you about some ethical dilemmas. If a surgery assisted by AI does not have the desired outcome or goes wrong, who is to blame in that instance? The AI, the surgeon? What steps need to be taken to fix it for the future?
It's a case-by-case decision, and I would say in most cases, blaming it on a singular factor is in surgery not accurate or not representing what's actually going on. In the case of an actual physical movement made by a robot or an automated system that leads to patient harm or something going wrong, then the maker of that system is legally responsible for that. And the insurance that are at the moment covering human error are very much in tune of covering those type of errors as well in the future. So they're getting prepared for that. We're working with large and small insurance groups that are very interested to understand those risks, but also cover those risks. A, because they fundamentally believe they're lower risks than what we have right now. And B, because it's a risk that can be in the future then mitigated by learning from it, because it's inherently more easy to record.
You talked about how some hospitals are resistant to introducing AI. Some of them, it's too cost prohibitive for them to install the systems, having the right IT systems, training the doctors. How do you make AI accessible to everybody? And that's something that's across the world, across the country, and people have different health issues in different parts of the world. How do you make it accessible to more people?
It is really case dependent on the cost of the system. If you think about ChatGPT type solutions, they are ubiquitous and they are available and they're mobile and you can bring them today. The two challenges that I see, and you alluded to both of them, I think one is how to use the system and how to access it. So how can it be done in a safe way, in a compliant way, without sharing too much data that shouldn't be shared, potentially about the patient or about the caregiver or things like that. And the second one is you need an infrastructure. So you need really to invest into digital infrastructure, into connectivity, into IT systems that are in the hands of the caregivers. And that is something that we see happening. We see it happening directly by governments and insurance companies in, let's say, in countries around the world. But we also see non-government players like foundations or NGOs or innovation funding, private foundations coming in to finance those measures. I think people have to understand that without health, we don't have a lot, if not anything. And even a small virus can shut down the entire world. And so I think it has shifted a lot of decision makers' minds and a lot of people's minds to think about this area very seriously and invest in it. And that's very positive.
Do you see Caresyntax have a huge role in training the next generation of healthcare professionals?
Yes, absolutely. I think training is very important. Education is very important. And specifically for us, I mean, we're not in all the different areas of healthcare. We are in surgery, and that's where our mission is also to enable the training and the education of surgeons and to scale the knowledge access for surgeons before, during, after surgery. So it's a key role for us, and it was one of our most successful early use cases. It was in university hospitals to be used for training of surgeons. It's a very important area, and we're quite engaged in it. We're very excited about it.
The last question I'd like to ask you today is just about your legacy. What would you like to be known for? What role would you have liked your legacy to be in your role in healthcare and AI?
If we can make a positive contribution to surgery becoming more digitalized and more scalable and more accessible, then I think that is more than anyone can ask for in terms of impact. So I think it's
right. That's huge.
It's a huge potential impact, and it's a very motivating impact. So I think that is what I and what we want to be known for is to support the surgeons and the care teams day to day, and to make that scalable so that people around the world have access to surgery, have access to safe surgery. And being part of that is something that we strive for. And if we make a positive contribution towards that, then hopefully we'll be known for that.
Well, thank you so much for your work, and thank you so much for taking the time to chat with us today. It's been really informative and enlightening, and I'm not looking forward to seeing a video of my next surgery, whatever that surgery is. But I'm glad it's out there. There's a potential for it to be out there if it needs to be.
Thank you so much for taking the time, Caroline. It was very nice to speak with you.
Likewise, thank you. Thank you so much for joining us today. For more videos and insights into the future of healthcare and AI, be sure to hit that subscribe button. Thanks for joining us. We'll see you next time.